This 9 a.m. from Fox 35. This is Good Day Orlando.
Say cheese, because it seems like everyone these days is posing for selfies. But that close-up picture, well, it has a lot of people taking note of things that maybe they don't really like about themselves or their face or their body. A new survey shows the selfie craze has more people actually going into the knife to try to improve their looks. And joining us this morning to talk more about it, Dr. Armando Soto. He is a board-certified plastic surgeon of Aesthetic Enhancements. Great to see you again.
Nice
Thanks
to
for
see you
coming
too,
back.
Thank you. Nice to be here.
This is an interesting trend. Are you seeing more of this at your office?
You know, we do see a lot of it, and I think it's really all about perspective. You know, people are taking more pictures of themselves. A lot of these pictures are really close up, and some of them they're making funny faces, and you know they're having interesting experiences. So it's bringing attention to flaws that they might not be so happy about.
What do you denote as a selfie surgery?
Well, there's two things going on that term is being used for. One is, you know, there's a lot of apps available now that allow you to really alter your appearance in self-portraits. And, you know, people want to look as good as they can in social media. So that's one thing to kind of Photoshop your face in these pictures. The other thing that we're seeing is the phenomenon we were just talking about, where people notice flaws in these self-portraits and they come see somebody like me to improve them.
You know, a lot of what happens in your office is medical, but there's definitely some mental things that go on too. Is that something that you talk about with patients beforehand, sort of do a self-esteem check with them?
Absolutely. That's a very important part of our training. Board-certified plastic surgeons are going to have a lot of training in how to help people understand what appropriate motivations are and trying to find the right balance and harmony between the flaw they're seeing, what they would have to go through to achieve their goal, and what a realistic goal would be.
The other thing I thought was interesting is something that we call the FaceTime face, which really, I got to tell you, it's not very flattering. It's just not, is it?
And all of us know somebody. I mean, I have relatives who refuse to FaceTime with me, you know, because they don't like the way they look on FaceTime. You know, technology is great, but it does distort your face a little bit, and I think that the distortion that happens with these cameras and the way we position them and stuff can sometimes bring out flaws that aren't of the magnitude we might be seeing. Are
there some things that you can do in office that maybe you wouldn't be considered major surgery, nip and tuck type things that you can do?
Absolutely, and those are the things that I think are appropriate. It's all about healthy perspective. So, you know, if the flaw is minor, we want to find an easy, simple solution that's not going to put you out, you know, a lot of money or a lot of downtime, and that doesn't have a lot of risk. Thankfully, technology in medical care has advanced just as quickly as it has in selfie-taking applications, and so we can do a lot of nice things in the office that aren't difficult to recover from.
All right, well, it really is fascinating, and everybody's doing it, it seems. Dr. Armando Soto, always a pleasure. And your website, if you wouldn't mind?
It's www.drarmandosoto.com.
Great, thank you. Okay, it is 9:15. Let's find out how things are looking.